Hello there, my name is Mac, and today I would like to share my story about alcoholism. Most days I couldn't remember waking up, eating, holding conversations, or even getting in the car and driving some places. There's a moment in your life where you appear to hit rock bottom and you think that there's no turning around. Luckily for me, when I hit rock bottom, I found people to surround myself with and help push me to be better. Here's my story.
2 p.m. Ooh, I'm really hot. My head hurts. Whoa. My boss again? This is the third time. Hello?
Mac, where are you? You're supposed to be at work.
Today?
Yes, this is the third time this week that you've been late.
Oh gosh.
If you don't show up today, I'm gonna have to fire you.
I'm not gonna make it.
Alright, well, consider yourself fired.
Fired. Mom's gonna kill me.
Matt! Again? Are you okay? Wake up! Matt! Somebody help! Call 911! Hi, Mac. It's Dr. Liz. You feeling any better?
No.
Does your head still hurt?
Yeah.
Do you know where you are?
Yeah, I'm at the Morosky Rehab Center.
Okay, that's right. Okay, I'm going to listen to your heart, see if it's slowed down at all. Can you breathe in for me? And out, nice and slow. And one more time, in. And out. Okay, it's still a little elevated, but that's normal. Typically when people abuse alcohol, their heart rate is a little bit faster. Okay, I'm just going to pull up your chart here real quick. Okay, so I'm sure you can recall a lot of the symptoms you were experiencing. Stumbling, slurred speech, sweating, aggression, rage, being withdrawn, the inability to recall events, retaining information, blurred vision, poor judgment, poor decision making, things like that, right?
Yeah.
Yeah, okay. So I'm just going to teach you a little bit about what was going on in your brain and why you may have been experiencing some of those symptoms.
Okay.
So there's general atrophy of the cerebral cortex, white matter, and forebrain, which are most commonly affected. The cerebral cortex is that outer covering of the brain that has all the bumps and grooves in it, which is what holds the information. The more information you hold, the more folds you get. So atrophy of that area would cause loss in that information stored there. The cerebral cortex is also extremely important for motor control and sensory control. The forebrain is just a general area that has a bunch of other structures. The cerebral cortex is also part of the forebrain, along with the thalamus, which is the relay center and tells information where it needs to go. The hypothalamus, which regulates body temperature and raw emotion, like rage and aggression. The amygdala, which is in charge of emotional memory. The hippocampus, which is in charge of spatial navigation and consolidation of memories. So converting your long-term memories to short-term memories. And the basal ganglia, which plays an important role in motor control and overall cognition. Alcohol abuse can lead to thiamine deficiencies, which commonly affects the limbic system, which is in charge of your memory, along with the thalamus and hypothalamus. Thiamine is a B vitamin that plays an important role in brain function. A deficiency can lead to short-term memory loss and Wernicke-Korsakoff syndrome. Okay, now we have the frontal lobe, specifically the prefrontal cortex, which is the most vulnerable lobe. The prefrontal cortex is responsible for planning, decision-making, judgment, behavior, things like that. The right hemisphere, which is responsible for coordinated interactions, is more affected by alcohol than the left hemisphere, which is responsible for communication. As you can see, the symptoms you have experienced from the use of alcohol is directly related to the brain structures affected. When consuming alcohol, these structures are still affected, and many, if not all, of these symptoms are presented. However, with chronic alcoholism and alcohol abuse, there is long-term damage and atrophy of these structures. Okay, now I know that was a lot of information to take in. Do you have any further questions for me?
Yeah, what's the next step to recovery for me?
Okay, so after you get out of here in a couple of days, we're going to transition you to Morosky AA. That's like a group therapy program to try and get you back on track. Anything else?
No thanks.
No? Okay, well, good luck. I'm going to check on you a little bit later.
Hello, and welcome to Morosky AA. Today we're going to define alcoholism and talk a little bit about the effects on the brain. So alcoholism is a chronic disease in which your body and mind become dependent on alcohol, or the need to consume alcohol to go through your daily activities, or the dependency of alcohol to get through the day. When consuming one drink, 10% of the alcohol is absorbed in the stomach, and the rest moves to the smaller intestine, where it's then absorbed into the bloodstream. Since our livers can only metabolize 15 milligrams per deciliter per hour, one drink an hour is all we can effectively metabolize. If you drink more than one drink per hour, this can lead to alcohol accumulation in our blood, and then in time is intoxication. Once the alcohol is in your liver, it metabolizes the alcohol with the enzyme known as alcohol dehydrogenase, which turns it into acetaldehyde, which is a toxic compound. When our systems build up of acetaldehyde, this can lead to symptoms which we know as a hangover. Once acetaldehyde is metabolized by aldehyde dehydrogenase, it becomes acetic acid. Acetic acid is also known as vinegar. All of this happens with just one drink. And imagine your body accumulating all of this acetaldehyde, acetic acid, and all being intoxicated. This is when we start to think that it's okay to yell at strangers, dance like a maniac, and my personal favorite, send that text message to your ex. Question in the back.
Why does that happen?
I'll explain it to you. GABA neurons are inhibitory neurons in the brain, and by activating them, alcohol works to increase the firing of GABA neurons, which in return stops the processing going on in different parts of your brain. But it doesn't just stop there. Alcohol also works its magic on the glutamate receptors. Glutamate neurons are also excitatory neurons, and the alcohol inhibits the glutamate neurons to decrease overall brain activity. One section of the brain affected is the prefrontal cortex, which is like the mom of the brain. So when you consume alcohol, function of the prefrontal cortex goes down. So now the prefrontal cortex is no longer the mom, but the crazy aunt in the family. Alcohol also affects your cerebellum, since it is in charge of coordination. The cerebellum interacts with the peripheral nerves, which controls your arms and your legs and helps coordinate your coordination. Chronic alcohol abuse can cause chronic impaired nerve damage, which can cause permanent nerve damage and cause permanent imbalance. Taking that all in, we can see how much alcohol can affect just one person and send us down a terrible path. But with the help and acceptance, all of you have chosen the path to recovery. And now, I'd like to welcome our most recent member, Mac.
Hi, Mac.
Yay! Hi guys, I just wanted to say thank you for welcoming me and helping me taking the next step into my life of recovery. I recently enrolled at Gannon University in the Sport and Exercise Science Department, so I'm super excited about that. And I'm officially 30 days sober.
Yay!
Because I was hospitalized and had a concussion and stitches put into my head, Dr. Liz put me in a hospitalization program. This was an individual program where I had complete residential care and access to staff that assisted me with my withdrawal symptoms. This transition led me back onto my own. I was put on medication and we worked on my goals of mine. I had great support from my friends and family, and the program drove me to deal with my symptoms with exercise. After this process, I transitioned here to group therapy, and I'm confident that I won't go back to my old coping mechanisms.
Oh, alcohol makes everything slow down. Heart rate, blood pressure, wakefulness.
The United States has the highest minimum drinking age.
Some symptoms of withdrawal include anxiety, depression, irritability, fatigue, tremors, palpitations, clammy skin, dilated pupils, sweating, headaches, vomiting, seizures, and insomnia. People continue to drink to avoid these symptoms, which is known as negative reinforcement.
With repeated use, there is a decreased response. This is known as tolerance.
Long-term consequences include dilated cardiomyopathy, arrhythmias, stroke, inflammatory changes in the liver, pancreatitis, cancer in the mouth, esophagus, throat, and liver, and vitamin deficiency.
It's a common misconception that alcohol raises body temperature when actually it lowers it.
Alcohol is one of the most commonly used psychoactive drugs in the world.
Out of all the recipes in the world, beer is the oldest.
I hope you all learned some valuable tips from my story, but be careful, have fun, but don't ruin your life.
What doesn't kill you makes you stronger.